This week on Sound Health, we bring you the concluding part on upper respiratory tract infection. Dr. Vincent Abimbola, consultant ear, nose and throat surgeon with the Lagos State University Teaching Hospital, has been diagnosing the topic for the past 3 weeks. Okay, Dr. Abimbola, sore throat is one of the upper respiratory tract infection. No doubt, it comes hand in hand with cold and catarrh and cough. What causes sore throat?
Okay, sore throat is an infection of tonsils. Tonsils is in the mouth. It's a structure at the side of the mouth. If you open your mouth, if you look at it, you see two structures there. These are the tonsils. When they are infected, this started causing symptoms, complaints. Complaint of difficulty in swallowing, when you are swallowing your saliva, there is pain, feeling unwell, fever. And sore throat can be due to something from above or something from below. Somebody who is having sinusitis now, that's catarrh. The mucus can be trickling down to the back of the nose and affecting the tonsils, giving tonsillitis. And something from below as well, from the chest, you have cough and it's coming through the mouth there. You can infect the tonsils, giving you tonsillitis. And then some dental infections, dental caries, spread because they are neighbors, spread there, they can affect it. Okay. And then when people share the same thing as well, mouth-to-mouth issues, you can get the tonsils infected.
Is this condition contagious, and what are the factors that make one susceptible to sore throat?
Body used to have sore throat maybe once or twice in a year, or they may not have it at all. And when he said sore throat is just an inflammation of that tonsils, which can be due to viral, can be due to bacterial, it can be due to fungal infection. So if somebody is having some viral infection affecting the tonsils now, and within from few days, we expect to go even without taking any medication, they get better. And if they have some bacterial infection, by the time you look at the tonsils, we'll be able to see the type of bacterial infection they have, because we have about 4 types of it where they can come down. So when this tonsils is diagnosed or having been infected, and infection, it can be something you can get from the person to person, maybe mouth to mouth, issues. So, or from those areas I mentioned about the sinus, the chest, the tongue, the teeth. When the condition is diagnosed, what we normally do is to treat. We treat with the appropriate antibiotics. And when we treat with the antibiotics, we always want the patient to complete their dosage of medication, so that they don't have a chronic stage of it. Because if somebody is having sore throat about 3 to 4 times in 12 months, in a year, we always advise that they should remove it, so that it doesn't become a focus of infection to other part of the body, like affecting the kidney, the joints, the heart and all the rest. So it's a condition that whenever you see that you have sore throat and you take, want to take any drug at all, maybe, you are, because a lot of people in this environment, by the time you are giving some drugs for 1 or 2 days and they are better, the next thing is just they forget it. Forgetting that, that tonsils now, it has about 15 pipes inside it, just for you to understand. We call it crypts. It has about 15 pipes inside it where some bacteria can lodge. If the bacteria, if you take drugs for 1 or 2 days and you are better and you drop it, within a short time again, the bacteria may multiply and cause infection again, and that's our reason for going to remove the tonsils when they keep on having it. So the advice is that by the time you are giving your drugs, you have to make sure that you complete it for a period of 7 days to 10 days, so that the bacteria can be fully killed.
Is there any relationship between one's immune system and one's immune depression and sore throat?
Yes. Well, when the body immunity drops, actually the tonsils, the adenoid, we call something adenoid at the back of the nose, because lingual tonsils, there are about 5 of them guiding the airway and food passage. Yeah. Okay, when this the body immunity drops, you now start having unnecessary bacteria that's not supposed to be causing an infection to be affecting those structures. Okay, like people who have like some people now who are immunocompromised, like HIV patients, most of the time they even come to to ENT most, because of the most of the symptoms is in the area of ENT. So by the time they come and we examine the throat, we are seeing a feature to suggest that we may have to change our treatment or investigate further to be able to make a proper diagnosis on that area. So the immunity, when the immunity of the patient drops, definitely all this area they can be infected very easily.
Okay, can poor oral hygiene be responsible for sore throat?
Yes. I was talking that the possible causes of sore throat, within us now is the sinus infection. That's why somebody is having sore throat all the time. We want to do an X-ray of the sinuses to be able to see that there's no infection there, because otherwise they keep on coming with infection. So somebody who is having dental caries, because the infection can spread from those areas to the tonsils. Somebody who is having some chest infection, by the time you are coughing, the mucus passes through those areas and they can infect it.
Can sore throat be deadly?
Yes, sore throat can be harmful to our health if there's a particular bacteria that causes the sore throat. That when we do our swab and we see that bacteria, so we want to be more aggressive in the treatment of it, or even advise that we do our surgery, because if it's left untreated, it can affect these organs of the body like the heart, the kidney, the joints.
If the tonsils are removed, will the system still function perfectly?
Well, the tonsils are, we call them, they are lymphoid tissue. They are for immunological functions, for defense. And we have other tissues even within the mouth area there that does this function, apart from the other, the bone and everything that produce all these lymphocytes, that defends the body.
So what are the treatment options for sore throat?
Well, medical treatment, surgical treatment. The medical treatment is for us to be able to treat based on the cause of it. If it's due to the bacteria, we give antibacterial drugs for adequate number of days, and we follow up the patient. We expect that everything is clear. And then if the patient keep on coming with sore throat, like 3-4 times in 12 months, in a year, so we may have to start advising to remove the tonsils, or if the tonsils should go ahead and form a pus, because at times we see the tonsils now, we have the tonsillitis now, it go ahead and form pus inside it, and we have to drain it. And such people, we have advise them to remove the tonsils so that it doesn't become a focus of.
If the tonsils are removed, will the system still function perfectly?
Yes, I think the tonsils are, we call them, they are lymphoid tissue. They are for immunological functions, for defense. And we have other tissues even within the mouth area there that does this function, apart from the other, the bone and everything that produce all these lymphocytes, that defend the body.
In this part of the world, we are used to home remedies, traditional herbs to treat ailments. What's the role of home remedies? Would you recommend home remedies like gargling with salt water to treat this condition?
Yes, like some of my patients, I will ask them, when they tell me that they have sore throat, I will ask them, like, how many times have you had this, like this? If they tell me that, when they take strepsils, they take maybe honey, or they lick what they call, or they use warm water, that they are better. I say, fine. You see, such people possibly the cause of their distance may be viral, which may be self-limiting, and all those things suit them. When they use honey, when they take they use warm water to gargle, they'll be able to loosen the mucus that are infected from the airway, so that their airway can be more clearer for them. So home remedy helps. You can see well for some few days. You cannot keep on using home remedy and your condition persists over 3, 4, 5 weeks. And I think they are taking home remedy. It's not advisable. So something else it can be going on. But your home remedy should stop within 1 week.
Oh.
Your home remedy should stop within 1 week. If there is no improvement, you have to start coming out to see the family medicine or who we can treat. And if they cannot treat, they have to now refer to ENT.
Thank you so much, Dr. Vincent Abimbola, for treating upper respiratory tract infection with us on Sound Health.
Thank you.
That has been Dr. Vincent Abimbola on managing sore throat effectively. Dr. Vincent Adekoya is a consultant ear, nose and throat surgeon with the Lagos State University Teaching Hospital. In the last 3 weeks, we've been trying to look at different types of upper respiratory tract infection with focus on influenza, cough and sore throat. This week, we wrap up the edition on upper respiratory tract infection. Hope you've been able to learn one or two things about the condition. Sound Health continues with trending and home essentials. Please stay with us.
This week on Sexual and Reproductive Health Rights. Sexual and reproductive health, including family planning, is critical to the fulfillment of human rights. Family planning is widely recognized as one of the most cost-effective health interventions. Decades of research have demonstrated that modest investments in family planning can save lives and dramatically improve maternal and child health. there is a growing push in the development community to reprioritize family planning because of the cross-cutting role it plays in achieving broader development goals, including the Millennium Development Goals and poverty reduction. Most fundamentally, access to sexual and reproductive health services enables individuals and couples to plan their sexual and reproductive lives, forming an essential aspect of human dignity and freedom. As pronounced at landmark United Nations conferences on women, population and development in Cairo in 1994 and Beijing in 1995, the right to control the number, spacing, and timing of one's children is fundamental to exercising reproductive rights. To do so means that individuals and couples must have the information and means to make informed decisions regarding their sexuality and reproduction. Moreover, the human right to family planning enables the exercise of other human rights, such as gender equality, for example, by allowing women to expand their life opportunities, increase their negotiating power, and raise their socio-economic status.
This is where we say thank you on today's edition of Sound Health. Hope you've learned how to stay healthy during the raining season. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.